Hi, my name is Emil Euaparadorn. I'm a physical therapist at the Spire Center out of New York City, Manhattan. Today we'll be discussing some stretches to do if you have a scoliosis. There are two types of scoliosis. There's structural and functional. Structural are the ones you're kind of born with and they kind of fixed deformities. Those are the ones that you cannot fix, but you definitely can prevent it from getting worse. Now functional is a scoliosis we get from because we compensate for something else. And in either case, you should kind of stretch away from the scoliosis. So what does that mean? A scoliosis means there's a curvature to your spine. So if I were to look at Dwayne over here, that means he would be tilted this way over here. Obviously, you wouldn't walk this way because your whole environment would be crooked. So what happens then, your neck tilts this way over here. And Dwayne is exaggerating, but you can see a lot of pressure crunching over here, overstretching over here, and overstretching over here. And with time, you eventually get pain. So what you need to do is learn how to prevent this from getting worse. So the first thing we're going to do is common sense stuff, is stop moving towards the side that you drop down. So in this case here, Dwayne, right shoulder is lower than his left shoulder. Okay, so when he's at work, he has to make sure his armrest is the right height. If it's too low, he's going to further go down towards his scoliosis. When he's carrying a heavy bag, if you only use it in his right hand, he's making the scoliosis worse. So there's two things you should really avoid. Okay? Now, before I show you the stretch, you should really get an idea how tight you're doing. So simply standing up and moving your hand down on your knee, making sure you don't compensate by moving side to side. Ask yourself, how far can I get? You should go past your knees, right? Of course, there's some variation. And then you do the same thing to your other side, okay? If you have a scoliosis, you're going to feel a discrepancy between the side, okay? So, in this case over here, if you have a hard time going to the right, this usually means you have a right scoliosis, just in case you were told by that by a medical professional, and you have to kind of loosen up your spine. Okay, so let's say Dwayne had a hard time moving this way, right, to the right. It means we have to lie on our right side when we do the stretch. If you have a hard time lying on your left side, you should lie on your left side. So now I will show you the stretch. So take a seat over here. Okay, you take the pillow and you fold it up. Usually it's best to put it on the apex of your scoliosis if you're ever informed. So let's pretend it was right around here. And lie down on your side. Keep your feet dangling. Okay? And you see what happens over here is that you're stretching into the right side like we did before. Okay? This is considered an aggressive stretch. However, if you don't feel much of a stretch, you can make it a little bit more by keeping your hand like this here to get a nice stretch of your spine over here. It's key that you totally relax and you breathe in. So breathe in. You really want to open up this rib cage. The rib cage has been tight and has been being crunched. Okay? Do this for at least 2 minutes. Let gravity do all of the work. If this is too aggressive of a stretch, you can bring your hand back down. Still too aggressive, you can just bring your legs back up here. Okay? That way is a less of a stretch. Okay? Now once you're done, can you stand up again? And you try to ask yourself, can I go down further? Okay? This tells you how long you should do a stretch for, right? So after your 2 or 3 minutes, stand up and do it again. If it still feels stiff or painful, you need to do stretch some more. Okay? So, once again, my name is Emil Euaparadorn out of the Spire Center out of New York City, and today we discussed how to stretch out a scoliosis.